Hello my dear friends, welcome to the Soundar Nursing channel. So in this video we are going to study about nursing diagnosis. So in the previous video we are already study about assessment. So definition of assessment, meanings, purposes, types. So that all are we are studying in the previous video we are already studied nursing assessment. So in this video we are study about nursing diagnosis in detail about the nursing diagnosis. What is nursing diagnosis? So this is the second phase of nursing process. Nursing diagnosis is a second phase of nursing process. Diagnosis is the clinical act of identifying the problems. What is the meaning of nursing diagnosis? Means this is a clinical act of identifying the problems. What are the problems are there? So through the help of diagnosis, nursing diagnosis, we can identifying the problems. What is the clinical act of identifying the problems is called as nursing diagnosis. This is introduction. Then let's study about the definition of nursing diagnosis. So according to the Nanda, nursing diagnosis is defined as nursing diagnosis as a clinical judgment about individual or community responses, actual or potential health problems or life process. So according to Nanda, what is the meaning of nursing diagnosis? Means nursing diagnosis is nothing but it is a diagnosis of clinical judgment about individual or community, that is actual or potential health problems or life processes is called as nursing diagnosis. So what is the meaning of actual and potential? Means actual is nothing but whatever the patient are having problems in the present problems we called as a actual, and potential is nothing but whatever the patient is having uh, future problem. Potential is nothing but future, means the already one problem is there, then the patient is having one more problems, means that we called as a potential. Actual means present problems, potential means another problems, future problems is called as potential problem. So in simple word, nursing diagnosis is nothing but it is a identifying the problems we called as a nursing diagnosis. Next, what are the purpose of nursing diagnosis? Why we study about nursing diagnosis, and why the nursing diagnosis means how the nursing diagnosis is help to us to collect the some data. So purpose of nursing diagnosis, first purpose is to analyze, collect data. First purpose is analyze the data about the client, that is first purpose, and second purpose is that to identify client's normal function level statement. Second purpose is identifying the normal function of the level of statement of the patients we called as a second purpose of nursing diagnosis. Whatever the patient is having normal function, so first we should know the normal function means, so then only we can find out the abnormalities. So second purpose is identifying client's normal functions level statement. Then third purpose is to identify the patient's strength and weakness. Strength and weakness, what all are the strength and the weakness is there, so through that also we can find out the exact cause so this is a third purpose of nursing diagnosis. Then last purpose of nursing diagnosis, that is to format a diagnostic weakness, and also to format a diagnostic weakness, so this is the last purpose of nursing diagnosis. Next, study about the types of nursing diagnosis. So in the nursing diagnosis, there are mainly four types is there. In the nursing diagnosis, first type is actual diagnosis, second is high risk diagnosis, third wellness diagnosis, and fourth is syndrome diagnosis. So let's study about actual nursing diagnosis. So what is the meaning of actual nursing diagnosis? Means a patient problem that is present at the time of nursing assessment. Actual nursing diagnosis is nothing but patient problem that is present at the time. at the time whatever the present problem is there, that is actual nursing diagnosis. Present problems we called as present problems assessment we called as a actual nursing diagnosis. And second point, it is a based on the present signs and symptoms. Whatever the patient is having present signs and symptoms, according to that we can find out the problem. So that is the actual nursing diagnosis based on the signs and symptoms. Based on the present signs and symptoms, identifying the problems we call as a actual nursing diagnosis. Actual nursing diagnosis is nothing but it is a problem that present at the time of nursing assessment. Present whatever we observe the problems of the patients we call as a actual nursing diagnosis. Present problems. Then second point, high risk diagnosis. So what is the meaning of high risk diagnosis? Means it describes a potential problems. It means what is the meaning of potential problem? Means it means patient is a prone to develop a problem than other problem if left in the similar condition. Potential is nothing but prone to develop problems than problems. Already one problem is there, but then another problem is prone or another problem is getting, means that is a potential. What is the meaning of actual? Means actual is nothing but present problems. Potential means more more getting, means more get to another different problems we call as a potential, means future problems is called as a potential. Therefore, no signs and symptoms are present. In the potential problem, there is no any signs and symptom is present. But in the actual nursing diagnosis, there is present of problems also, and the signs and symptoms also be seen in the present only. But in the actual nursing diagnosis, we are seeing there is no any signs and symptoms. This is about the potential nursing process. Then let's study about wellness diagnosis. This is a third type of nursing diagnosis. Wellness diagnosis is nothing but it is a clinical judgment about an individual, family, community in transition from a specific level of wellness to a higher level of fitness. Wellness diagnosis is nothing but it is a judgment of individual, families and community in the specific level of wellness, that is higher to higher level of the wellness. Take an example, birth of newborn twins. Birth of newborn twins is an example of wellness diagnosis. Then fourth type of nursing diagnosis, the fourth one, that is syndrome diagnosis. So what is the meaning of syndrome diagnosis? Means a cluster of actual or high risk nursing diagnosis that is predicted to a present because of certain event or situation. Syndrome diagnosis is nothing but it is a cluster of actual or high risk nursing diagnosis. Actual is nothing but that is a present problems, or high risk nursing diagnosis that is predictable to the present because of the certain events or situation. Take an example, rape trauma syndrome. Rape trauma syndrome is an example of syndrome diagnosis. This is a four type of nursing diagnosis. Next, statement of nursing diagnosis. In the statement of nursing diagnosis, there are mainly three parts is there, that is problem, etiology and identifying characteristics. So what is meaning of problems? Means problems is nothing but patient is complains that what all are the patient is facing the problem. So being a nurse, you should be observed which problem is there to the patients and what patient is want exact exact health education or whatever the deficit about the knowledge about the conditions and decisions. So that is whatever the patient is having problems, we should be educate to the patients that is come under the problems. Then what is etiology? Etiology is nothing but causes, whatever the causes is there. So about the causes we call as the etiology. Then defining characteristics. Defining characteristics is nothing but we can call in easily, that is subjective and objective data. Defining characteristics means in the subjective data, whatever the patient is having problem, the patients only can explain you whatever the whatever the exact problem is there. Then objective data is nothing but whatever the patient is told you can observe and action, and you can take the actions, that is a objective data. So defining characters is nothing but in the simple word, whatever the patient is told you in easily you should be identify and you can find out the exact cause. So that is a defining characteristics, means whatever the exact cause is there, just simply identifying the problems, means defining the some problems we called as a defining characteristics. So this is about a nursing diagnosis, notes and some explanations. So if you have any doubt means please text in the comments box. Thank you for watching.